Hello everyone, so this is part one of my little talk about the knee to try and help you understand a little bit more about the anatomy before I start showing the exercises that can help you out. So a bit physio nerdy this one, so bear with me. This is your knee. It's made of basically two joints, so quite often people come in and they'll say to me, I've been experiencing knee pain. And me just showing off a bit will tell you that actually no, it's your kneecap. That's the problem. This is your kneecap here. The knee is a simple joint, really. It's a hinge joint, so it has one movement. It bends and it straightens, or we would say is flexion and extension. And the kneecap, as you can see, when you're bending the knee, will kind of track in the same sort of plane of movement. Now, depending on what part of the knee we're dealing with, there's different severities of sort of damage or that may have occurred. So normally when we're talking about knee pain, people will come in, they will describe pain being anterior, so or around the front of the knee. Now these injuries are mainly associated with exercise, so things like running, cycling, or even just walking. And what they indicate is a problem with your biomechanics. Now, to give you an explanation that fits sort of normal day to day, is think of your knee a bit like a car wheel. So if your car wheel's tracking is out, you'll wear out the tyre. So essentially, if your knee tracking is out, you'll start to wear out and damage material. Unless you change the tracking, so in which the angle in which the knee is pointing, you're going to keep re-damaging it. You can replace bits and bobs and you can make things a bit loose and a bit more flexible, but unless you deal with the biomechanical failure underneath, this problem's going to keep coming back. So anterior knee pain, a couple of things it can be. One is it can be the tendon. So the tendon can get a little bit thickened and inflamed, we call that tendinitis. It could be something called your fat pad. Your fat pad is here. So if you ever look at your knees and think underneath your kneecap it looks a bit squidgy, it's probably that your fat pad, which is in here, is inflamed and irritated. You can have something called ITB, friction syndrome. Any of you runners out there, you've probably heard of your ITB before and physically hate it. It's a horrible material, sort of tensile strength of steel, runs down the outside of the knee, runs on the outside of the knee and attaches just below the kneecap. And again, is an indication of biomechanics not being quite right. And also you can get sort of general tendinopathy as well of the tendon above the kneecap. So a couple of things that we will be looking at from a physio point of view is, well, when you're standing on your leg, where is your knee pointing? If you're rotating inwards too much, it would mean that your bottom, so your glutes, which are much higher up towards your hip, have failed. So which means that your ITB, which runs through here, is being pulled tight and is starting to rub and get inflamed. Your kneecap tracking, that word we used again, is out. So it's starting to rub on its own groove here. Or the tracking is out again and the tendon starting to rub on its own protective sheath. So this can get inflamed. Or everything is, because it's overly taut, overworking, it's got too tight and it's squashing the kneecap into its own joint. So the actual joint itself has got inflamed, or the fat pad's being impinged. Okay, so what's the most common one? I would probably say it's going to be fat pad impingement. It's where thigh muscles are too tight, tendon's a bit inflamed, and that pad of fat underneath has got thickened, and it's basically whenever you're bending your knee, it's getting squashed, so it can be quite sore. Second, probably going to be patella, this one here, tendinitis. So the tendon's inflamed and irritated. Again, thighs are too tight. That means that the tendon's kind of rubbing on itself a little bit and it's got inflamed and sore. Third is going to be your ITB, friction syndrome. Again, when the knee is rotated biomechanically in the wrong place, the ITB is pulling really, really hard, and the point at which it attaches into the tibial bone here is basically becoming inflamed and irritated. And then fourth is going to be something along the lines of the back of the kneecap being irritated. That's more long term, that's more associated with joint degeneration. So early steps would be tendinitis, fat pad impingement, ITB. If you leave it too long, that's when you start getting sort of patella tendon problems. patellar joint problems. Okay, all of those are associated with biomechanical failure, so bum failure, over rotation, poor tracking, and then muscles having to compensate and work harder, ITB quads, and that puts a lot of pressure through the joint and causes those irritations. In the next part of the video, I'll show you a little bit about how we're going to kind of combat that. Internally, more serious injuries are associated with this blue thing, which don't worry, the human body is not blue, is your meniscus, which you'll know is your cartilage, or the ligaments, which you might be able to see in there, and one here and one here, called your cruciate ligaments or your collateral ligaments. Those injuries are usually either degenerative, so they're happening over a long period of time, again associated with poor mechanics, or a lack of strength, which has caused extra load, extra pressure through the knee joint, and therefore damage. Again, the exercises I go through in the next part of the video will help teach you how to offload this area. Or injuries to these points are trauma. So new to running down a hill, leg buckles underneath you, and essentially you twist and you tear and damage one of these ligaments, or you kind of tear a little bit of the meniscus and it has a little bit of a sort of a flap in it then. Or worst comes to worst, things like skiing, which luckily at the moment with us all stuck indoors, that's not going to be happening anytime soon. Those traumatic injuries are a lot more difficult to deal with, and that's when you certainly need to have a proper physio assessment. To be fair, any knee problem, you should be having a physio assessment anyway, so we can have a look and determine what's going on a bit more about your independent mechanics. But definitely with meniscus, cartilage, or ligamentous problems, you need to be having a chat with somebody like myself who can give you an idea of what you need to strengthen to help offload that area. So again, the more proper knee injuries, so cartilage and ligament, are associated with long-term degenerative injuries or trauma. So that's kind of a brief introduction to the knee, very brief introduction to the knee. Think of it as a basic, simple joint that just bends and straightens. But if your mechanics aren't quite right and your tracking is out and your knee is not quite in the right position because certain muscles have failed, it means that other muscles are going to pick up the slack, which they're not necessarily designed to do. They're going to get inflamed. They're going to cause damage to other tissue. That's going to create pain. And that's how you're going to start getting sort of certain discomforts around the front of the knee, around the back. So that's a brief introduction to the knee, and look out for the next part of the knee sort of videos to teach you a little bit about a little home exercise program you can do to help prevent these sort of injuries. Okay, thanks guys.